Good morning. Our presentation is on chronic traumatic encephalopathy. My name is Charles Potts. My group members are John A. Boylan, August Gardine, Ethan Machado, and Candace Trimble. Ann Hernandez was a prominent All-American football player. He was drafted in the fourth round by the New England Patriots. He then went on to sign a 5-year extension and $40 million contract. He also appeared in the Super Bowl. CTE defined: a progressive and fatal brain disease associated with repeated traumatic brain injuries. Aaron Hernandez is one of the worst cases of CTE ever found in a person his age. He got charged with double homicide and a slew of weapons violations. At sentencing, they gave him life in prison without the possibility of parole. He later committed suicide in his cell.
As Charles stated, CTE is believed to result from repeated head trauma. Football and ice hockey players, as well as military personnel, have been known to develop CTE as a result of their continued involvement in demanding conditions that frequently result in physical collisions. In football alone, 70% of the players are Black, which further showcases one of the ways that the Black community is being adversely affected by CTE. It also reinforces how being highly prevalent in these sports or activities that are likely to result in continuous head trauma can be detrimental. Unfortunately, physical abuse is another factor that has increasingly been associated with CTE. CTE is also a critical disease that is thought to cause the areas of the brain to waste away. And as a result, many people with CTE will exhibit symptoms of other neurodegenerative diseases such as Alzheimer's, ALS, Parkinson's disease, or dementia. Therefore, some of the main symptoms include difficulty planning and carrying out tasks, impulse control problems and aggression, increasing confusion and disorientation, and short-term memory loss. And while some of these symptoms may seem simple at first, over time they can get increasingly worse to the point where one begins to experience frequent mood swings, depressive symptoms, or suicidal thoughts.
Now that you understand what CTE is, as well as its symptoms, the question still remains of how to treat and diagnose it. Unfortunately, due to a lack of knowledge on the subject, these questions still remain relatively unanswered. As far as diagnosis goes, CTE can only be confirmed in a patient post-mortem through an autopsy. And while this might be the case, researchers are actively trying to find tests for CTE that can be used on people while they're still alive. The goal is to use a variety of neuropsychological tests, brain imaging such as specialized MRIs, and biomarkers to diagnose CTE. As for treatment of CTE, there's currently no long-term and effective way to treat patients. The best way to avoid CTE is to avoid head injuries altogether. Obviously, there's still a lot more research needed on this topic.
For our case study, we looked at an unnamed NFL football player who we will call John Doe. John played football in high school, college, and later in the NFL as a linebacker. During his college and NFL years, John received 11 concussions, with only one being medically confirmed. When John turned 40, his family began to see mental impairments, like short-term memory, attention, concentration, judgment, planning, and organizational deficits, among others. These symptoms gradually got worse over a 5-year period, and he became very angry and verbally aggressive over little things. He began to consume more alcohol, even though he had no history of depression, and he also had no history of psychiatric illness or illicit substance taking. As well, his family was negative for dementia and other psychiatric illnesses. He died at 45 years old, and post-mortem brain analysis, there was evidence of CTE. Now, take this sample of John Doe's brain on the left and a healthy tissue on the right. So you can see here that these dark kind of lesions and holes are signs of CTE.
The case of John Doe isn't an isolated event. In fact, in a 2017 study of CTE, 110 out of 111 brains of former NFL players showed evidence of CTE. There are additional sports associated with an increased risk of brain injury, such as soccer, martial arts, ice hockey, boxing, rugby, and bicycling. Unfortunately, brain injuries in sports can go unrecognized, undiagnosed, and underreported. So how do we address the unrecognized and undiagnosed brain injuries? We must educate the public to bring about awareness and knowledge of brain injuries and their symptoms. We can prevent progression of CTE by regularly screening and evaluating for symptoms. This includes prioritizing mental wellness by encouraging our youth and adults to regularly check in with their physicians. It's necessary to create a safe space for these types of check-ins to prevent CTE. It's our responsibility to protect our brain, and it's up to us to change the trajectory of the progression of CTE. Protecting lives is worth it all. This concludes our presentation. Thank you for listening.